Thank you, Bill. Good morning, friends. I'm supposed to be a keynote speaker. The only problem is the key is missing because the presentation that I sent was on an email ID which was not the email ID where presentations were being pulled. With the key missing, I'm left with a note. And with that note, I'll try to be the keynote speaker to the extent I can, which is also nice because the topic and the theme I'm going to share about is not yet a reality. It's something which friends across continents, and I mean friends of clinical engineering that work with us, right from Adrian in Australia to Zoe in China and friends in Brazil and Tom in US are all brooding for years. And the question is that if God forbid earthquake strikes in Haiti, we have Medicine Sans Frontiers, WHO, Red Cross that send their engineers to help patients and hospitals. If a tsunami, God forbid, strikes in Southeast Asia, we have the same organizations like the Red Cross and WHO who reach out to these places, including places that are torn in conflicts in parts of Africa and Central Europe. But there doesn't exist an organization that pools volunteer clinical engineers, biomeds, technicians to send them in places which need them most. Now, these places surprisingly are places where healthcare cannot be provided by institutions like Red Cross or WHO unless the machine works. And when they send their teams of doctors and nurses, obviously biomedical engineers remain a small or negligible minority, which perhaps make their purpose and mandate less effective than it could be. So what we thought about is what are the intricacies that are involved in pooling human resources. And right from Adriana's book in the WHO on Human Resources for Health to the International Labour Organization's nomenclature on health that can serve across borders, when we looked at issues which are required to be addressed while transferring human resources from one location globally to another location globally, are one, is it going to be a paid work or an honorary work? And when you look at the horizon of all organizations that send their trained human resources for work in areas of conflict or geographic difficulty, almost all of them is honorary work, which means the issues of visas and those logistics are not required because it becomes a much lesser burden administratively. So what we have decided is that on this Clinical Engineering Day in Italy, 2019, we are in next 2 days laying the architecture of an international biomedical service foundation, which would provide clinical engineers and biomedical engineers who are opting to serve in an honorary capacity in any location globally for a minimum period of 4 weeks. Facilities such as air transport and local accommodation, so that they could fit into the work of various agencies that provide health care by providing the clinical engineering skills. Of course, the pooling of resources that is required to provide the accommodation and transport, including air transport, is something which is being worked out by the contributions and support of close to 22 organizations globally, details of which I had on my PowerPoint presentation, which I'll be happy to share with all of you later on. But while this support is being worked out, this support is something which is obviously needed to fund human resources that are willing to travel, which left us with two questions. Pooling of resources, for which with the support of CED division of the IFMBE, we are trying to put together an online system where people could request or put their request to be available for service for the duration of their choice, and two, match them with the location of need. As of now, we have about 56 locations globally, right from Lithuania to Rwanda, where institutions and governments have sought for help, ranging from one clinical engineer to as many as 22 clinical engineers. And across these locations that are already being mapped, we would be in next 30 days putting together the needs and resources availability online statement, where interested individuals could actually scan through the needs, opt for the duration of service that they would like to perform, and thereafter the International Biomedical Service Foundation would be bridging that gap, providing with the administrative and financial resources. Now, this is something which is like a dream for many people, because we would have a global platform matching needs and resources, enabling individuals to provide volunteer service for the duration of their choice, but also bridges an important human resource gap between the work being provided by many medical agencies like the Red Cross or WHO and the clinical engineering systems that they use in these resource limited settings. So broadly, if I were to summarize why this information was being intended to being shared in this session was, and in many other sessions during this conference, is simply to allow you all to know that in next 30 to 45 days, there would be a virtual platform where needs and resources availability would be mapped, and you are most welcome to put in, to view and put in your interests if you have interest in serving in any of the resource limited settings. With that, thank you, Bill, and I'm glad I kept it short so that you can take forward your panel. Thank you.
Thank you, Jitendra.